Most of us learned personal hygiene as children, and once those habits were formed, we rarely question them again for the rest of our lives. But here is something almost no one tells you, say it plainly. The body changes so significantly after 70 that certain hygiene habits, which were once optional, nice to have but not truly urgent, become genuinely important for avoiding serious infection, hospitalization, and in some cases, complications far more dangerous than most people realize. Today, I want to talk about 3 specific parts of the body that deserve real, daily attention after 70. Why each one carries far more risk than most families understand, and exactly how to care for them properly, starting today. I want to say something before we begin, because I think it matters more than people realize. None of what I am about to share is meant to frighten you, or to suggest that your body has become fragile or unreliable simply because the years have accumulated. It is meant instead to hand you real, practical knowledge, the kind that so rarely gets discussed openly, whether at a doctor's office rushed for time, or within families who feel awkward even raising the topic in the first place. Understanding exactly why these 3 areas matter gives you the power to protect your own health and comfort proactively, rather than discovering the hard way, after an infection or a hospital visit, what a few extra minutes of daily attention might have prevented entirely. Before we get into these 3 body parts, if you find real, practical guidance, like this valuable, the kind of information that genuinely protects your health or the health of someone you love, I would be grateful if you would like this video and subscribe to Golden Wisdom. It takes only a moment, and it helps this channel reach more people who need exactly this kind of honest, practical care. Now, let's talk about the first of these 3 body parts, and I promise you, it is one that carries far greater risk than most people ever imagine. The first body part is your mouth, and specifically, your teeth and gums. I want to be honest with you about something that surprises almost everyone the first time they hear it. Poor oral hygiene in someone over 70 is not simply a matter of bad breath or the eventual loss of a tooth. It has been linked, in study after study, to serious conditions throughout the entire body, including heart disease, and in some of the most concerning cases, a type of pneumonia that develops when bacteria from the mouth are inhaled into the lungs, a condition doctors refer to as aspiration pneumonia. Here is why this happens, and why it becomes considerably more dangerous after 70 specifically. As we age, the muscles involved in swallowing often weaken somewhat, meaning that tiny amounts of saliva, food, or bacteria from the mouth are more likely to be inhaled into the airway rather than swallowed completely, especially during sleep. If the mouth is full of harmful bacteria built up from inadequate brushing or unclean dentures, those bacteria travel directly into the lungs along with that inhaled material, and this can develop into a genuinely serious respiratory infection, one that is far more dangerous for an older body already managing other health concerns. This is precisely why brushing twice daily, morning and night, is not simply a matter of a bright smile or fresh breath after 70. It is a genuine safeguard against a chain of events that can lead to a hospital stay. If dentures are part of your daily life, they deserve exactly this same level of attention. Dentures should be removed and cleaned thoroughly after every meal, not simply rinsed under running water, but properly brushed with a denture-specific cleaner to remove the bacteria and food particles that accumulate throughout the day. At night, dentures should be removed entirely and soaked, allowing your gums a genuine period of rest and recovery, since gum tissue that remains covered around the clock is considerably more prone to irritation, sores, and infection. And I want to add something families often overlook entirely. Regular dental checkups remain just as important after 70 as they were at 30, Arguably more so, since a dentist can identify early signs of gum disease, ill-fitting dentures, or oral infections long before they become painful or obvious enough to notice on your own. I think of a man named Harold, a widower living alone, whose daughter noticed during a visit that his dentures seemed to be causing him visible discomfort at dinner, though he insisted repeatedly that everything was fine. It was only when she gently examined them herself that she discovered he had been cleaning them with nothing more than a quick rinse under the tap for months, assuming that was sufficient, exactly as he had always done decades earlier when his own natural teeth required far less specialized care. A proper cleaning routine, along with an adjustment from his dentist for dentures that had genuinely begun to shift as his gums changed shape with age, resolved discomfort. He had quietly been enduring at every single meal for far longer than necessary. He told his daughter afterward that he had simply never realized dentures required an entirely different kind of daily care than the teeth he grew up brushing, and I suspect he is far from the only person to make that same honest assumption. I also want to mention something that surprises many families, which is the connection between oral health and appetite itself. Sore, infected gums, or dentures that no longer fit properly due to inadequate care can make chewing genuinely painful, leading many older adults to quietly shift towards softer, less nutritious foods, or to eat noticeably less overall, without ever directly mentioning that pain is the actual cause behind this change. If you notice a parent or spouse eating less than usual or avoiding certain foods they once enjoyed without any clear explanation, I encourage you to consider oral discomfort as a genuine possibility worth investigating, rather than assuming it reflects a simple loss of appetite alone. The second body part I want you to think about carefully is your feet. And I want to tell you plainly, this is the one that catches families most off guard, because feet are so easily forgotten, tucked away in socks and shoes, rarely inspected closely the way we might examine our hands or face. But after 70, feet deserve genuine daily attention for reasons that go well beyond simple comfort. Circulation naturally declines somewhat as we age, meaning that blood flow to the feet, the part of the body furthest from the heart, is often reduced compared to earlier decades of life. This matters enormously because reduced circulation means that any small injury to the foot, a blister, a small cut, even minor skin cracking from dryness, heals considerably more slowly than it would have earlier in life. For those managing diabetes specifically, this risk becomes even more serious, since diabetes can also reduce sensation in the feet considerably, meaning that a wound may go entirely unnoticed for days or even weeks, quietly worsening without any pain to signal that something is wrong. This exact combination, reduced circulation and reduced sensation, is why foot injuries in older adults, particularly those with diabetes, can sometimes progress to serious infections, and in the most severe untreated cases, to complications requiring hospitalization or even amputation. This is precisely why washing and drying your feet daily, thoroughly, including carefully between each toe where moisture tends to linger unnoticed, matters so much more after 70 than it may have in earlier decades. Moisture trapped between the toes creates an ideal environment for fungal infections, and cracked, dry skin on the heels and soles creates an entry point for bacteria, exactly the kind of vulnerability reduced circulation makes so much harder for your body to fight off effectively on its own. After washing, apply a good moisturizer to the heels and soles, though I want to emphasize, not between the toes, since excess moisture in that particular area actually increases the risk of fungal infection, rather than preventing it. And I want to encourage you to make foot inspection a genuine daily habit, not simply washing quickly, but actually looking closely, or asking a family member to help you look at the soles, heels, and the spaces between each toe, checking specifically for any cuts, blisters, redness, or swelling that might otherwise go unnoticed until it has become considerably more serious. If mobility or flexibility makes it genuinely difficult to inspect your own feet closely, whether due to arthritis, back pain, or balance concerns about bending over safely, please do not simply skip this step entirely. Ask a spouse, an adult child, or a caregiver to help with this specific task regularly, even if you manage the actual washing independently. A second pair of eyes catches details that are genuinely difficult to notice on your own feet, particularly the soles and heels, which are nearly impossible to examine properly without either significant flexibility or a mirror positioned carefully on the floor. The third body part, and I want to address this one directly and without embarrassment, because too many families avoid this conversation entirely out of discomfort, is the genital and perineal area. This particular area deserves genuine daily attention after 70, and the reasons behind this go well beyond simple comfort or odor, extending into some of the most serious and most commonly misunderstood health risks older adults face. As we discussed in an earlier conversation here at Golden Wisdom, urinary tract infections become considerably more common in older adults, partly due to changes in bladder function, and partly due to reduced mobility, which can make thorough cleaning genuinely more difficult to manage independently than it once was. When this area is not cleaned properly and consistently, bacteria have a much easier opportunity to travel into the urinary tract, leading to an infection that, in someone over 70, often does not present with the burning sensation or urgency most of us associate with a typical UTI. Instead, it frequently shows up as sudden confusion, agitation, or a noticeable change in behavior. Symptoms that families and even some medical professionals sometimes mistake for a sudden cognitive decline, when in truth, proper hygiene and prompt treatment could have prevented or quickly resolved the entire episode. A geriatric nurse once shared with me a story that I think illustrates exactly why this particular area of care deserves the direct attention I am giving it today. She described a patient, an otherwise sharp and independent woman in her early 80s, who was brought to the emergency room by her worried son after several days of sudden, uncharacteristic confusion, forgetting familiar faces, and mixing up simple details of her own daily routine. Her son was convinced, and understandably terrified, that he was witnessing the sudden onset of dementia. After a thorough examination, the actual cause turned out to be a urinary tract infection, one that had developed quietly over several days, likely connected to reduced mobility that had made her usual thorough hygiene routine considerably more difficult to manage entirely on her own without acknowledging that difficulty to her family. A short course of treatment resolved the infection completely, and within days, her sharp, familiar personality returned entirely, along with her memory and clarity. Her son later admitted that he had nearly agreed to a memory care facility before the infection was properly identified, a decision that would have been based entirely on a temporary, treatable condition rather than any genuine, permanent decline. I want to address something directly here, because I know this particular topic can feel uncomfortable to discuss openly, whether you are speaking about your own body or caring for a parent or spouse. There is no shame whatsoever in needing help with this specific area of daily hygiene, and there is no shame in asking for that help directly, whether from a spouse, an adult child, or a professional caregiver trained specifically in this kind of care. The discomfort of the conversation is genuinely temporary. The health consequences of avoiding it, repeated infections, painful skin breakdown, or a confusing and frightening episode mistaken for cognitive decline last considerably longer and matter considerably more than any temporary awkwardness in asking for the help this area of care sometimes requires. Now that we have discussed all three of these body parts together, your mouth, your feet, and your genital and perineal area, I want to bring this back to something practical you can genuinely begin today. Brush your teeth thoroughly, morning and night, and clean dentures properly after every meal, giving your gums real rest overnight. Wash and dry your feet daily, including carefully between each toe, and take a genuine moment to inspect them closely for anything that looks even slightly amiss. And clean your genital and perineal area daily, more often if incontinence is part of your daily life, without hesitation or embarrassment standing in the way of what your body genuinely needs. I want to acknowledge something honestly before we close, because I think it deserves to be said plainly rather than left unspoken. All three of these areas of care can feel, at times, genuinely tedious, small tasks added onto an already full daily routine, easy to rush through or occasionally skip on a particularly tired day. I understand that impulse completely, and I am not asking anyone watching this to approach these three habits with rigid, anxious perfectionism. What I am asking is that you understand clearly why these particular three areas matter more than the average daily task, so that on the days you are tempted to skip them entirely out of simple fatigue, you remember what is genuinely at stake and find even 5 extra minutes to give your mouth, your feet, and your most intimate areas the attention they deserve. I know these three areas of the body are not the ones our culture typically celebrates or even discusses openly, especially compared to the more visible parts of daily hygiene most people never think twice about mentioning. But I have come to believe, after everything I have learned and witnessed over the years, that the parts of our care we are most tempted to overlook or feel embarrassed about are so often exactly the ones that matter most for staying genuinely healthy, genuinely comfortable, and genuinely independent in these later years of life. Do not let embarrassment or simple habit keep you from giving these three areas the daily attention they truly deserve. If this video gave you something useful today, something you or someone you love can put into practice starting this very day, please take just a moment to like this video and subscribe to Golden Wisdom. We share honest, practical guidance like this regularly, the kind that treats your body, your dignity, and your independence with the genuine respect they deserve. Thank you for spending this time with me today, and I will see you in the next one.